Wait a minute. Add yourself back in, Lindy. Hello. Welcome to the Gorgeous Glow Skin Show. I'm your host, Dr. Sonia Johnson. And little technical difficulties here. Let's bring the host on. Let's see. So I'm going to go back. Yeah, press the button because you deleted yourself. Okay, so great. Okay, here's our host. Perfect. Okay, perfect. Sorry about that. A little technical difficulties here. Okay. All righty. So I'm Dr. Johnson, your host. Welcome to the Gorgeous Glow Skin Show. I help women who want to have even and clear skin tone with increased confidence. If that's you, you're at the right place. So today we're going to talk about caring for your skin in the age of coronavirus, and basically what skin presentations you can experience with this infection and how to prevent that. So we have a wonderful guest here, Dr. Lindy Hayes, and she's going to help us with that. Hello, Dr. Hayes.
Hey there. Good evening, my friend and sister and neighbor and my medical mogul girlfriend.
So with that, we were thinking about, how in reality, the coronavirus does not cause any true skin changes that will help you diagnose the infection at all. Okay, but it does because it is a virus and an infection. Nevertheless, you need to know about some symptoms or signs that you would see with the skin, so you know how to take care of it. Okay. So, Dr. Lindy, Dr. Lindy is an ER physician, so she's on the front line every day. And so she sees a lot of these changes that people are experiencing with their skin when they have this infection. What have you seen, Dr. Lindy?
Well, so what and good evening, and again, thank you so much for having me, Dr. Sonia. Thank you so much. From life-threatening stance, to see much more significant skin changes in a virus so severe and life-threatening as coronavirus. But usually most of the skin changes that we see in viral infections are usually very benign. But there are some skin findings that you can find in coronavirus, just like you find in any other type of infection that involves the virus.
And so that's what makes it, really a little unique. So therefore, a lot of doctors are not looking at the skin changes as much as the other symptoms that you can have, such as the, intermittent fever, as well as, shortness of breath. Is that correct?
Yes. So of course, from our standpoint, the most concerning and the red flags that go up in the emergency department are obviously fever, lasting for that is unable to be controlled over 3, 4, 5 days to a week.
Okay.
Just current fever, no matter how much anti-fever medication you're taking, you're continually spiking fever.
Oh, wow.
And then the coughing, mostly it's dry cough coronavirus, and then the shortness of breath. So of course those are the most concerning findings that we see. But again, of course, you can see some very, very mild skin changes in very mild disease, similar to any other type of a virus or coronavirus, which not this particular strain, not 19, but other strains of coronaviruses, as we know. But the most life-threatening skin changes that we see are, again, very late in the disease, and they mostly manifest as a problem with the circulation.
Right.
Because what happens with the coronavirus is that it ultimately causes shock. Your body is trying to preserve itself and kind of preserve its most vital organs. And so you may have a patient that comes in with very severe skin changes like blue fingertips or really cold fingertips and cold toes, things of that nature. That's the most severe.
Okay. Okay, great. So definitely, I would think the take-home message is with this pandemic situation that we're in, if you feel sick, just go to the ER, and so they can make sure they can catch it early if there is an infection with the coronavirus. But if not, they'll let you know, if it's just a common cold or the flu. We're getting out of the flu season, but still, I'm still sure still some cases out there. And so, again, this is not something you want to take lightly. As you can tell, everybody is, is told to stay home to try to diminish the spread of this for that very reason. So, so with that, just keep that in mind. So, okay, I think that lost Dr. Lindy again.
So I'm trying to come back now.
Okay, she's coming back again. So sorry about that technical difficulties. As we know, with perfect. Okay, let me add you in. Okay, so with that, so these are, like I said, very non-specific changes that you see with any viral infection. Okay, and that's the problem. So you really don't look at the skin as your go-to of diagnosing this condition. But regardless of that, the goal, of course, is not to even have the infection. So how, with the skin, we talk about hand washing, and people really talk about that to the extent because you just really, something so simple can make a world of difference. And what's your experience with that? When you're in the ER and seeing patients about the hand, and even other doctors, what are you all telling people concerning hand washing, and then just what to do to, help their skin or to prevent infections from the skin involvement?
Yes, absolutely. So at home, you are, and all of our information, one of the things I want to put out there, and I'm sure you have as well, all of our information is, we use a resource of the CDC, the Center for Disease Control, or the World Health Organization. Okay, and any link that they may kind of connect you to when you go onto their website. So all of this information you can find there. Any other information, you want to be very, very careful of the resources that you're using. So in this day and age, we stick with the CDC or the World Health Organization. And with that, in terms of the instructions about hand washing, so we say, wash your hands frequently. So we wash our hands, obviously, between every patient. And at home, you want to wash your hands very frequently. You're going to clean off all commonly used surfaces, computer areas, desks, those kinds of things. But of course, in the emergency department, we're washing our hands not only typically in between every patient. I actually, when I go in to see a patient after I have on my personal protective equipment, I actually wash my hands again in the patient's room. Mm-hmm. And I use something to turn on the faucet if I'm not in a room that has automated. So very, very people preferably in according to them. So okay, and it's not it's sanitizer that be preferably 50% alcohol instead of soap and water. Hand sanitizer is to be used if you do not have access to soap and water, preferably. Now, what we do oftentimes in the emergency department, we do both. So we'll wash our hands very thoroughly for 20 seconds at least, usually at least a half a minute. I'm usually washing the front and backs of my hands under my fingernails as I'm talking to the patient. And this is, again, after I have already washed my hands before, right in between the other patients that are right before that patient.
Right.
So we wash our hands a lot. And the thing about the hand sanitizer, in addition to the soap and water,
right,
a lot of times in our hospital, the hand sanitizer does have a moisturizer in it. So it's very helpful because It prevents some of that dryness that the general soap and water, causes with your hands, and the kind of the discomfort and the soreness and all that, and irritation. So the hand sanitizer, in addition to the soap and water, is what we practice in the emergency department.
Okay. And so, a lot of people, I see a lot of people with hand dermatitis in my office. And of course, this is the time of the year to have that. But, when you wash your hands a lot, and really in this case, it's really important to wash your hands. If you pet your dog at home, you wash your hands. Before you prepare your food, you wash your hands. After you cook your food, you wash your hands. After you clean your surfaces, you wash your hands. Definitely if you're taking care of a loved one or a sick person, you want to wash your hands before and after you're done caring for them. And even yourself, if you sneeze, wash your hands. Or if you touch your face, wash your hands, because that is so huge. People are talking about washing, their face, around the nostrils, around the eyes, the mouth, because these are sites of, infections where, entry for the coronavirus. So it's very important to do that. And, we're seeing pictures of, people having like rashes due to washing your face a lot, especially if they wear the mask, healthcare that are working with patients. And so this is where I would say, yes, continue to wash, but you may want to carry a little moisturizer around if you can. Of course, wipe it down so it won't get infected, because as we know, the coronavirus can stay on surfaces for up to 2 to 3 days. And so with that, definitely wipe that down, your container. But, a good moisturizer with ceramides in it. And the beauty of ceramides is it's a new thing that's out. And, it on the front of the label, people will say, it'll say with ceramides, your moisturizer. So definitely, you want to try to get something, because ceramides actually put lipids back into the skin and keep your skin soft and supple. And moisturizers act, again, as a somewhat protective barrier too. So you won't have a lot of port of entry of your skin with, the virus or any other foreign particle, that's in the environment. So, with that, it's just so important, we have the social distancing. And so we have the, everyone staying at home, so we can diminish the spread of this at home. Just cleaning your surfaces really good. Yes. Also, and you want to make sure your sanitizers, on the CDC, they talk about the sanitizers having at least 60% alcohol content. So that's really important, because there's if you really look at the back of a sanitizer, just different sanitizers, every last one has different ingredients. And so people are allergic to sanitizers, but believe me, that does not mean you're allergic to all sanitizers. Right. You need to see what's that ingredient you are allergic to. But a lot of there's so many different choices in sanitizers. So, you need to find the one that works well for you. And like Dr. Lindy, you were saying, the sanitizers are moisturizing. Some are, and I know some are not. But again, it's to find your preference. A lot of, as we know, you can't find them now.
That's right. That's right. So you know what I've been doing, Dr. Sonia? I have found some good old fashioned ethyl alcohol in our house. Yes. In some, in the back of the medicine cabinet, or in that pantry, or in that, in that closet. We pull that out, and that's what we use. We just put a little bit in the cap and pour it on your hands, and just go back and forth with your hands, the back of the hands, the palms, underneath the nails and everything. And that little bit goes a long way. And
okay, so, good.
I've never been so happy to find that big old giant, thing of alcohol. Right. Your grandma always told you, make sure you always got to have some alcohol. You never know.
Right. That and hydrogen peroxide. Those are the two, right?
That's it. Those are the two. And Vaseline.
And that's right. I was gonna say that, but I was like, maybe I'm the only one, because I have like one in every bathroom.
That's right. That's right.
Oh yes,
right.
Yeah. It's simple. I'm about. My thing is simple.
Hand sanitizer. I have not found any.
Right. It's at our office we had a stock supply. Because I have a medical office, so we just have our share for every room.
Yeah.
And I just have one because I can't use every hand sanitizer. I have allergic reaction to it, but. At home, I just say, okay, soap and water. And I have a nice moisturizer, Vaseline right there on the counter. So, but I agree with you, so definitely, like she said, you have some alcohol at home, there you go. Use it if that's what you want to do, if you don't want to use soap and water, so. But any other tidbits you would like to share with the audience, Dr. Lindy?
Let's see. Well, you talked about, sometimes having, because of all the hand washing we have to do and the allergic reactions and just kind of the skin irritation. You talked about even our masks and things like that.
Mhm. Yes.
Sometimes as physicians, I know there's I meant to bring it with me to show it to you for fun, but it's a mask that we kind of call it our, it looks like a space mask. I mean, it's kind of huge and it's got these big circular things on the side and it's got a big
Right.
nasal suction, like it suctions the whole face so that there's nothing open here. It
Okay.
looks like we're going into a war zone. And sometimes some of my colleagues, we have, because we wear it almost all shift. And so you get
Okay.
this redness kind of around your face and things like that. So that's not
Right.
uncommon. I mean, it's not
Okay.
anything I would be,
Worried about.
urgently
Mhm.
concerned about. But
Mhm.
for your viewing audience, I think the biggest thing is just realizing some of the reasons to go to the emergency department. So I did just want to say that really quickly. We because of the influx of patients that are coming into the emergency department all across the country, and of course we know some areas are worse than others. We really want our patients to have the communication with their primary doctor and the primary doctor's office. So preferably the, first thing you want to do if you have some concerns, you're coughing, you're not able to keep a fever down, you are having fevers, you want to call your primary doctor's office first, right away. Most of the primary doctor's offices in our area, and I know across the country, are really trying to work together with the emergency department so that we don't overburden the emergency department,
Right.
and trying to really make sure that everybody is in the loop. Include the
Right.
primary doctors, the emergency department, everybody. We are all a team, and we're really trying our best to really communicate through this very, very trying and difficult time. And so you
Yes.
want to call your primary doctor's office first. You may notice some minor skin changes at home. If you are sweating, you're feeling like hot and cold chills, those kinds of things, you're noticing, just beads of, sweat curling up on your skin. You want to, check and see if you have a fever. At that point, that's some of
Mhm.
something very important in terms of a very simple skin change that you may see. You may just be warm to the touch. You may not be sweating. You just may be warm to touch. Somebody may walk by you at home and say, "Oh, you feel like you're really warm." That may be an
Mhm.
indication that you have a fever. Or if you are flushed, your skin is normally one color, but now it's, either super red or maybe pale or something like that. That also may be an indication that you need to call your primary doctor and get to the emergency department. But I will say, if there is any concern about you all and your audience reaching their primary doctor, to go to an urgent care or an emergency department. We have different areas in, I know, my facility and other ERs across the country where we are have a special triage practice in place for this influx of patients. And so we want to encourage our folks to come out if there's anything that they're concerned about and they are not able to reach their doctor, to go on and come out. Don't stay home because of insurance. Don't stay home because you don't have this or that. We want you to come out so that you can be evaluated.
Okay. Well, thank you so much, Dr. Lindy, and thank everyone for joining us. I just wanted to share some things, a little information, so what to do, when to do it, basically. And so again, thank you, Dr. Lindy, for your expertise on this
Thank
subject.
you.
And oh yes, and so I just again want to let everyone know we have a guest Saturday, so we will not have a show tomorrow, Friday. We will have a guest Saturday morning, and so again, join us at noon. And again, I'm your host, Dr. Sonia Johnson, a board certified dermatologist and creator of the Gorgeous RX system. I help women who want to have even and clear skin tone with increased confidence. Again, you're at the right place. Thank you for joining, and you all have a wonderful evening. Thank you, Dr. Lindy.
Thank you,
Take
Dr.
care.
Sonia. Talk to you
Bye
soon.
bye. Okay, bye bye.